Hey beautiful soul, I'm Dr. Shaill Gupta and today we are going to make a reaction video on Brett Maverick's hair transplant. Hey Brett, you are doing a great job. I love your videos. I have been following your videos. You really make good content. We know Brett got a transplant done 6 months back and he had posted some videos on his channel. Now this is a video which he posted after 6 months completion of his hair transplant which he got in Turkey. So let's start the video.
About 6 years ago, I woke up one day and noticed that my hairline was receding. So, after many years of deliberation and lots of research, I finally decided to hop on a plane and fly to Turkey to get a hair transplant. I got it done by the Dr. Suregon Aging Clinic, and I got 2,400 FUE grafts. And this is how it looked directly after. So, this is the 6 month update.
We can see the pictures, and some pictures have been taken from his previous video where he got a transplant done. Brett is now 27 years of age and probably he started noticing some thinning and slight recession of hairline. But as we can see from the pictures which he had posted in previous videos, yes, there was quite a bit of recession, though the quality of his hair behind the receded hairline seemed pretty good. So just a slight recession and slowly progressing over a period of maybe past 6-7 years. That means he is a good candidate for surgical correction of hairline. But how far shall we go? I think he's telling that 2,400 grafts have been done. I think it's too much for that particular portion. For a hair transplant surgeon, donor is one of the most important investment which we are doing together as a team. So I would not like to invest 2,400 grafts in that area. Probably it doesn't seem like 2,400. It seems to me maybe around 1,600 grafts which has been taken out and implanted. A subtle work in hairline seems little better where we invest on the transition zone, which they have done here. We can see they have done a nice job. And but yes, lowering of hairline, probably I won't go for that much of lowering.
What you think down below, and then here's how it's looking in the back. Because as you know, if you saw the procedure vlog, then there was a ton of scabs in the back. That's where they pull the hair from. I'll put a picture up, and yeah, you can.
We can see in the donor area they have taken out grafts quite high up. This is called unsafe donor zone and grafts shall not be taken out from that portion. But yes, when you are aiming for high numbers, sometimes 3,000, 3,500, 4,000, 5,000, and you are doing just FUE, either the surgeon is going to over harvest or they are going to move to unsafe donor zone, and both the conditions are not good. So in this case, even for a small number, I think it's around 1,600, they have gone quite high up. It should not be done. Yeah, right now his donor seems okay with long hair, but if he shaves it off, we'll see scars all around. And those who think that FU is a scarless surgery, it's not the case.
The hair just kept growing. I changed up my hairstyle. I tried some different hairstyles. I tried to like slick it back and blow dry it, make it look like a cool quiff. But I noticed that it just looks better with this like kind of crazy bedhead type of look because the hairs are already really wonky looking. One thing I mentioned at the 4 month update was that there was kind of this odd space in between the front line of the transplant and then the rest of the transplant, and I was a little nervous about that. I think since then the hairs have gotten a little thicker, so it's started to kind of like blend in better. And I think as time goes along, it'll start to look even better. But I'd be lying if I said I wasn't a little confused with why they left such a gap there. I think it would look better if they put even just a few more hairs in between that little gap.
So here we can see there are two lines. One, the dense line where they have done the merging and they have done it really well. And below that, they have created a line with softer hair to create irregularity so that it doesn't look straight, it looks more natural. But yes, one important fact here, Brett is not taking finasteride. Now, if someone starts taking finasteride, a lot of softer hair grow in these areas. You see those softer hair if you see these different cases where finasteride has been given. And if you look at the temple areas, if you look at the hairline, no transplant has been done, but these softer hair which have grown in apparently completely bald area, even in grade 7 patients, these softer hair really make a very ugly or pluggy hairline look very natural. But yes, when the result is given without the medicine, without finasteride especially, it it is real test of the skill of surgeon. Again, this is really important, and a lot depends on the dosage of medicine as well. If the medicine is given at small doses, maybe microdosing around 0.2 mg or per day, or maybe one fourth of the dose, then the effects which you get in terms of those softer hairline, you get less effect. When the medicines are given at higher dose, 1 mg per day, which is usual US FDA approved doses, then this result is amazing. If I show you this patient here, see the result. He was 41, 42 years of age, having grade 6, grade 7 baldness. We gave him 1 mg finasteride per day. No transplant was done. You can see the change this medicine, Propecia or finasteride, brought at 1 mg per day in few months, 4 to 5 months. Now, the patient developed some sort of side effects because of the medicine, sexual side effects. We had to reduce the dose, we reduced it to half, and you see the result is also reduced. It is still better than the pre-picture before starting the medicine, but yes, the result has gone down. If we reduce it to one fourth, the result will be one fourth. So the effect which you get from the medicine is directly proportional to the dosage of medicine. So any hairline can be made to look great with the help of medicine, and medicine not only improves the thickness of transplanted hair, it also grows small, finer hair as I have just talked about. And imagine what will happen to these results when medicine is added. Imagine what will happen to Brett's result when he starts taking 1 mg finasteride per day. It will be totally undetectable, very thick hair, but then he becomes dependent on the medicine. He won't be able to leave the medicine, and there are issues like dependence and tolerance which are seen with finasteride or minoxidil, which one has to be careful about. When we give a result without the help of finasteride or minoxidil, it is a real skill test for surgeon. We have to take care of the density, merging with the existing hair, and the softer look of hairline. So when you see a result, especially you are looking at the hairline, the quality of hairline, whether it is detectable or undetectable, there is a lot of difference, and this can really misguide you. You can take wrong decisions. The hairlines which I am showing you, one of myself also, I did this transplant 2 years back. I'm not on minoxidil or finasteride, and you can see the hairline which I got. It looks pretty good and natural. So all the three components have been taken care of. The other results which I am showing you here, in those also the hairline has a good, softer, natural look. We call it Satya's mimic nature hairline, but it really takes a lot of artistic skills and imagination.
I have been using keto cortisol. Man, I can't think of the name of it. Shampoo every other day. I just apply it normally and wash my head normally. I can do that again. I can wash my head normally again. I think after a month you're allowed to wash your head normally. And also I'm using minoxidil foam. I just use the foam. I apply it right behind. I apply it right behind the transplanted hairline in 3 big dabs, and then take my hands and just rub it in there as far and deep as I can. I think it's not so important to get the minoxidil on the newly transplanted hair because, as far as I know, it's DHT resistant, so the new hairs are permanent. So
Now, there are two issues. One, ketoconazole shampoo alternate days is not good for your hair. Maybe you can use it once or maximum twice a week, not more than that. It can have a harmful impact on your hair. Second, More importantly, he's using minoxidil, he's using it behind the transplanted hair, presuming that transplanted hair are DHT resistant and they are never going to fall off. I've made many videos about this, that transplanted hair can also thin out, they are not permanent. Transplanted hair can acquire characteristics of recipient site, and this is called phenomena of recipient dominance. So they acquire these features, they have tendency to thin out, and they do thin out. So you need to apply the medicine over transplanted hair also, especially in the transition zone where there is a potential of them going thin or completely fall off.
Concerned about the hair behind it that I want to reinforce and make sure that I maintain. Other than that, the doctor recommended that I get on finasteride, and I actually got the prescription. I got the medicine. I got it in my cabinet, but I haven't started taking it yet, just because a lot of people I know have had pretty bad side effects, like depression, erectile dysfunction, acne, stuff like that. And they say that less than like a couple percent of people experience this, but I've seen so many comments of people that have had those bad side effects, and even close friends of mine that reached out and said, "Hey man, just so you know, be careful. I had post finasteride syndrome, and that's something I want to definitely avoid, So I don't know. I got the stuff. I just haven't started taking it yet. I don't know. I might just hold off until I can get my hands on some topical finasteride that I can just apply, so it's not in my whole bloodstream and maybe not as potent.
Yeah, here he is mentioning that he was prescribed 1 mg finasteride and he did not take the medicine because he's scared of the side effects. And though it happens in 1 to 2% of patients, but yes, it is there. And as he is mentioning, many of Brett's friends faced this problem. Now, not taking finasteride because of the fear of side effects is one thing, and not taking finasteride because you don't need it is a different thing. So in his case, if the hair loss wasn't really very rapidly progressive, his quality of his hair behind the transplanted area, this portion was thick and not really thinning out, he wasn't a candidate for finasteride. Now finasteride is something which is being prescribed to almost every patient of hair transplant, and telling them that we have done the transplant and you take the medicine just to sustain your existing hair, it is necessary. Now some people tell you that okay, you take it for 6 months, 12 months and then stop. Some people tell you, oh, this is like a blood pressure medicine, you just take it for and keep taking it and as long as you want hair. No, that's not true. If I was his surgeon, I won't have started finasteride, but yes, finasteride can do magic. I have told you, it can make any XYZ result look great because it grows so many hair. We have just discussed. And if you have doubts, you can go through this link also, and there are blogs on this website which we have, Satya Hair Solutions. You can go through the blogs, you will find a lot of stuff there about this. So if I am operating 100 patients, not all of them definitely need finasteride. I am one of those. I'm 46. I did my transplant 2 years back. My hair are pretty good. I'm not taking minoxidil or finasteride. So why would I like to bring a medicine which has issues like dependence and tolerance? I know when I stop using finasteride, or for that matter even minoxidil, I'm going to face severe rebound hair loss, which can be more severe than your pre-existing hair loss. Secondly, if I keep taking the medicine for indefinite period, one fine day medicine will stop responding on my head, on my hair. So that means this is called tolerance. That means either I increase the dose of medicine to have the same effect, or I switch to dutasteride. And the same story can happen with dutasteride also. So if I start at 1 mg per day, which is like starting a race at the finish line, it can cause problems. I'll give you an example. For example, you see this patient, we did around 4,000 grafts for him. We just had put him on minoxidil. He had good hair at the back. You can see the pre-pictures. The donor also seems pretty good. The back area, the transition zone, it all look really good. We did the transplant. 5 months picture now I'm showing you, where the transplanted hair were not growing to their full potential. You can see the donor area, the transition zone at the back of head was also thinning. We did not start finasteride even at that point of time. We waited for another 4-5 months. At 10 months picture which you are seeing here, again the condition hadn't improved significantly. You can see there was thinning in the transplanted area and the donor was still thinning out. At this point of time, we introduced finasteride not at 1 mg per day. We gave him 1.5 mg per week, 3 half tablets a week. That is much lower than 7 mg per week. And see, in 3 months' time, the whole situation changed. The transplanted hair started growing thicker. The other areas, the donor area backside, improved significantly. You can see in the pictures. How did this happen? These hair were already there, transplanted, but they were not growing to their full potential. Medicine also helps to improve the thickness of transplanted hair. Sometimes it can be affected along with the existing hair. Sometimes it is not affected, only the existing hair thin out. This may differ from person to person, and that is why we need to customize the treatment plan. In Brett's case, again finasteride was given at 1 mg per day, prescribed, though he didn't take it, but it was prescribed. And it would have made this transplant look amazing, a bomb, but it is not always the case. Now, prescribing finasteride to every patient blindly, if you have got a transplant done, and you have used the medicine, you have been prescribed the medicine, share in the comments down below. Write all the questions which you want to ask us, we'll answer it, because it's a journey which has to be planned. We have made it simple for you by creating an e-brochure. You can download 7 easy steps to plan your journey for free by clicking the link given in description. You can visit the site Satya Hair Solutions, where we have discussed in depth about the role of medicine, the methods, planning of hairline, everything. Go through the content, watch it, and plan your journey. We wish best of luck to Brett. His transplant looks pretty good, and let's hope it turns out well. And thank you for watching. Love yourself. Stay blessed.